Future shining bright, helping students reach new heights. Wellness care with Rob, you so right. Business with my boo, we take the lead. Hospital beauty service.
So, hello everyone. Welcome to Ignite with Dr. Angela. I'm the host, and I'm excited to be with you today. So, here on this podcast, we talk to people who are 50 and older who are thriving in their 50s. These are people who are stepping into their next phase. We talk about their life, their love, their careers, and reinventing themselves. It's often that this next phase is the best phase. My guest today is very special. Her name is Deborah Curtis. Hi, Deb. How are you?
I'm wonderful. How are you?
I'm doing well. Thank you for joining me today on Ignite with Dr. Angela. So why don't you start off by telling me a little bit about yourself and your next phase?
Okay. Again, Deborah Curtis. I'm excited to be here. So thank you so much for inviting me. This is a good friend of mine. I'm so happy and proud of you for what you're doing. I've been a nurse
Well,
for
thank
30
you.
years now.
Okay.
30 years, I can't believe that. Nurse
Time
practitioner
passes
for
quick.
when I started in nursing years ago together. And I'm happy what I'm doing. I am married, a wife of 15 years to my high school sweetheart. We got married years later. And so I have two bonus children and seven bonus grandchildren.
Wow,
So I'm
nice. Okay.
excited about that.
Okay. So I know that you have a wellness clinic. As a matter of fact, you treated me at your wellness clinic. And
Yes.
yes. So tell me a little bit about how you decided to start your wellness clinic. You did something before that too, didn't you?
Yes, I did. Again, I was in ICU again with you many years ago, and then had a family business called Professional Nursing Services, which is a home healthcare agency. And we did that for many years. I love doing that. It was a family-owned business, so to be able to work with your family was wonderful. It was a godsend. And but with doing that, we were working with a lot of chronically ill patients. Patients at home, immobile, latter stages of life, and things of that sort. So being able to pivot into what I did now with my clinic right now is Next Level Health and Wellness Clinic. And what that is, I'm able to go from what I've seen in the past, again, from dealing with people for chronic diseases into, how do I want to put it? I guess I want to say going from chronic care to preventative care. And that's what I'm
Okay.
excited about
Okay.
because we need that in our communities to be able to educate people to just, so they be happy, healthy in their next phases of life.
So instead
So
of curing, you're trying to prevent people from getting
that's
there.
right.
Yes. Okay. Okay. All right. And so then you decided to tell me about your clinic.
So my clinic is called Next Level Health and Wellness. And what it is, it started out being for weight loss. Because again, what I had lost weight many years ago in 2023. I lost 35 pounds. I feel wonderful. I would do it again if I needed to, but hopefully I won't. But if I will, I would. And that was my springboard into what I'm doing, I guess I would say right now. So lost some weight with some other nurse practitioners. Feel amazing, you know, differently than how I thought I would feel at this age, at this time. Uh, the aches and pains are gone. I used to get up in the morning, sit on the side of the bed. There was a systems check, what hurt, what aches, what's doing whatever. I don't have those issues now. I'm jumping up, I'm getting up, I'm out there getting ready for the day and just happy about life. And the way I feel and felt, other people need to feel this way. And that's really what springboarded me is so I know I can help other people feel this way if they just take that plunge into getting healthy.
And so when you say that, I have to say that you were a mentor to me. And for me, starting my own clinic, and exactly what you said, first of all, I had to see it before I could be it because I was a little bit nervous about the doing the weight loss. So I also had my own journey. And when I saw you in your before and after, I quickly came over to let you treat me. And I had the same feeling. I wanted
Mm-hmm.
to let everybody feel this way because we don't have to live with the aches and pains and not looking the
Yeah.
way we want to look.
Mm-hmm.
So thank
Mm-hmm.
you for mentoring me.
Oh, well,
And
you were
so,
easy. You were easy to do. You didn't mind. And I will say this too, because again, we did we did the GLP ones. I'm not afraid to say that to anybody. I was
right,
screaming from the mountaintops because it's a tool. It's a tool. It's not an end all be all. It's not magic. You may feel like it afterwards.
right,
And part of what we teach people and instruct people to do, like you said, with eating better, talk about different things as far as health. You already doing that. You're
right,
already working out. That's the biggest part of it.
right. Already
By your
working
meat,
out, eating
we
right.
inspire.
Mm-hmm.
Mm-hmm. So
Okay.
we've inspired each other, I guess, as we did back in the day as well.
Okay.
Because I wasn't working out as much as I needed to, which is part of why I had gained the weight over the
Okay.
years. You're younger, you don't have to do much of anything. You just wake up.
Right.
The
Right.
day when we woke up like this, we woke up like that back then.
Right.
Shake, we didn't have to do anything. Couple years come along, you start, having children or just, again, living life, busy. Few pounds pick up. Next year,
Changing
what they said,
hormones.
years about 5 to 10 pounds it could be per year.
Right.
you know. So you were easy because again, you were already doing a lot of the things. You were a perfect example though, actually, because like you said, people they're doing the same thing over time, and then now we get to a point that it's not changing.
It's not working anymore. Those calories in,
Mm-hmm.
calories out doesn't work anymore.
Mm-hmm. Mm-hmm. And just information that's out here is a blessing right now.
So, if you had one thing you could tell me that you love the most about your next phase, what would that be?
Oh my God, what I love the most about it, being able to talk to, educate, and teach people that's open to listening, and teaching people things they can do again to just be healthy. Again, my biggest thing I use now as I'm gonna say a tagline is that we talk about generational wealth, and now we're looking at generational health.
I like
Generational
that.
health is generational wealth
I
because
like that. Yep.
as we know, we heard so many people talking about, well, my mom had
Mm-hmm.
diabetes, my dad was hypertensive, but you don't have to be. Change
Mm-hmm.
the narrative for you. And I think that's what we're doing now, not just myself, you and I, is changing the narrative for a lot of people who didn't know that. The science that we have now, we didn't have that science before.
Right.
Our
Right.
people would love to have been going through what we're going through now.
Yep. The science is amazing and it's just getting better if you read the articles
Yes.
and the research. So, what obstacles would you say you've had in achieving your next phase?
Oh God, what options do I have? Um, some of it was financial, not so much on myself. When we were doing, again, caring for people in the community,
Mm-hmm.
resources was difficult for a lot of patients that didn't have the financial means for it. The ones that did, it wasn't as difficult, but for those that did not, and the education that they had was limited. And so just making some of those changes and trying to educate people on what they would need to do a bit differently. That was a bit challenging, I guess I should say.
Did you find that there was a lack of resources in the community to help these people?
That's exactly what it was. Right, lack of resources. Things would change. It would cut off different things, and even with home care visits. I'm back in the day when I was doing home care many years ago. You could go see a patient and do wound care every day.
Mm-hmm.
Wounds heal much quicker, much faster. Now with Medicare changes and some of the changes they made, it's one or two times a week. Now they want family members to learn how to change wounds and things of that sort. It doesn't heal as fast that way. That's not what they were trained for. Not that they couldn't do it. And some didn't want to do it. That wasn't what they were used to doing.
And so it seems like something that they think is going to save them some money ends up
Exactly.
costing them more money in the long run.
Exactly.
Mm-hmm.
Expensive. So now we just have to learn to do it ourselves. I think more people are open now to um, more healthier options.
Mm-hmm.
Not want to take as much medication. I mean, I think that's changing. So I think we're getting more into that now. So it makes it a little easier, but it was definitely more obstacles with that before.
Okay.
We get
Okay.
into a different phase, I think, with the community who want to do different things as far as being healthy.
What advice do you have for somebody who is maybe a
Mm.
little afraid to take that step?
Oh, wow. What would I say? I would say do it scared. Do it anyway.
Mm-hmm.
And I know that's easy to say because I've heard that many times. And it just probably doesn't, a bit condescending to some people, because you just have to prepare. And like you said, that imposter syndrome does come into play.
Mm-hmm.
But it's important to just, what I tell people to do is to pray over it. Pray, have faith, jump out there. I won't say just jump off a roof and just make it happen, but God usually will put people in your path to help you. I'm sure I've had people to help and assist me because you have to not be afraid to ask for help.
What would you
You
say
will have
to
some people who won't. Pardon me?
What would you say to someone who is afraid and thinks that there's no way? They're afraid to fail. What would you say to them?
Oh, I want to say there was a saying, but I don't know if I can remember it. People would say, if I want to go back to school, if I want to open business, and it's a couple of years, and people say you're going to be that age anyway. So whatever it is, if it takes 4 years, 4 years from now, you're going to be that age anyway.
4 years is going to pass. Yep.
It's going to pass, and you're going to look back and wish that you would have done it, and you don't want to have any regrets. I want to live the rest of my life with no regrets.
Okay. Okay.
But I know that can be challenging for people that have, challenges going on in their lives. But again, if they talk to the right people, if you talk to enough people, someone usually will be there to help you along the way. And you have to prepare. You still have to prepare, not just jump out there. But usually if you're out there, you're doing it for the right reasons. I would say that as well. There's usually, the universe usually talks back to you and gives you what you put out there. But just like I think with us, we were here to make a difference for other people. Nurses, I think always, the medical health professionals, we always here to try to help others. And so usually a way is being made, and I think that it's available. Just try it. Just try it, have faith, get out there, talk to the right people. Somebody will respond positively.
And if you fail, try again.
Try. Try again. Try again. Someone will be out there to help you.
If you could do it all over again, would you change anything? Would you add anything?
If I could do it over again, what I'm doing right now, the position I'm in right now, I would have done this years ago. The only regret I really have is that I don't have more time to do what I'm doing now with the time that I had before.
Okay.
But I would still do it again. I
Yeah,
would do it
that's
again.
very prophetic. And I would love for some younger women to actually hear that so they know they can do it. Speaking of women, I know that one thing I wanted to talk to you about, women's health, you've been talking about doing more with women's health. Tell
Yes.
me some about the women's health, because we talked about that before, and we know the treatment with the GLPs has been amazing for women's health. Tell me some of the things you're doing with women's health.
Well, what I'm doing with women's health right now, which I'm excited about it as well, is because I'm gonna say women of a certain age, mature. I'm not going with that. I want to say old. I'm not going with old, but the age that I am right now, I'm menopausal. I'm menopausal. I'm not afraid to say that because I enjoy being menopausal because there are some benefits to being
Oh,
menopausal.
yeah, there are a few benefits to that. Yes.
There's some benefits to being menopausal. But with that, menopausal, perimenopausal, is that when it comes to weight loss as well, oftentimes people think they maybe get at a stall, they can't lose the weight like they used to. And again, like you mentioned before, it's not calories in, calories out. It's
Right.
hormone. Insulin resistance is a big issue when it comes to that. That's hormones, and insulin changes your hormones again as we get older, because as your insulin level goes up, your hormones go down. And so with that comes about is women's health. So what I have been doing with a lot of women, and some men as well, because I do have some men clients as well, is hormone replacement. Now,
Okay.
some people believe in hormone replacement, some don't. It's being educated. Because I don't know if you remember that years ago, they had debunked the whole, hormone replacement before that it caused
Right.
cancer,
Right.
causing, there's so many benefits to it
That
right
whole
now.
study just really stalled
A lot of people.
a lot
A
of
lot of
people to do hormone replacement. Yes.
And then when you get to more studies, it showed that more women died within that time frame, unfortunately, that they had debunked that now.
Right.
More women have died in that time. That was just amazing to look at some of the studies and research for that because it shows that some of the benefits, as we know, you have the hot flashes, you have the mood swings, the brain fog, the cognition, able to sleep, more so some of the other ones that we hear about.
Joint
But one of the
pain,
biggest is bone
joint
health, the
pain, yes.
cardiovascular. There's so many benefits that goes along with that. Um, and so when they show with that is that with the bone health that if you start on hormone replacement earlier on in perimenopause, you have more benefits than starting to say at my age.
Right.
But but not that there are not any benefits at my age. You just have more benefits when it comes to the bone health. Because when they talked about, I know I'm talking too fast, I'm sorry, but when they talked about the women that had hurt themselves and had died within that study, was women that they didn't have that protection with the bone health. So now they break your hip
A fracture,
and it was
yes.
exactly practice. So that's a big difference, and we can really change that. Some of the research also showed that there are some women, believe it or not, in their 80s and 90s on hormone replacement right now.
Wow.
I
Wow.
didn't even know that. I'm like, oh my God. And I have a couple of colleagues that I know that they mentioned one lady 88 years old and one at 90.
Wow.
And their family said she cannot go off of hormone replacement because it's helped with her dementia. So, I mean, this is research that we need to just keep looking at and monitoring and paying attention to. Because again, I want to live the rest of my life healthy as I possibly can. My next year is my best years.
This next phase is our best phase, most
That's
definitely.
right.
When you talk about
That's
insulin resistance, what's one of the biggest outward signs that you see with insulin resistance?
Oh my goodness. Two different things that we see. Well, let me say this because I'm gonna get, because I was like a little kid, like raising my hand. Is that pretty much that little tire around your waist,
That tire around your waist.
tire around your waist,
Yep.
and that comes with insulin resistance, and then a little bit of that comes with as we get older when it comes to women and with the menopause. So between the two, taking care of both of those, you have a winning hand.
And I always say that's fat that you can't exercise off. It's going nowhere.
Exactly. So many people have tried.
Right, right. It does not go anywhere.
It does not go away. It can't. Ours has.
Oh, there you go. Yes, it has.
Ours has. And one thing I want to mention, just since we're talking to many people, is what they're showing again, because even though GLP-1s they're not a new medication,
No, they're not.
they're not a new medication, but some of the research that they're doing now is still new, meaning that is what they've shown of some is a lot of people that have been on the medication before, when they get off and they get back on it, the weight doesn't, as people will say, fall off as it used to. It doesn't really fall off like it's. You can still lose the weight, but you might put a little bit more effort into it.
Right,
You know,
right.
but it still works wonderfully.
It does work wonderfully. As long as people know it's not a one-off and it's just a tool in your toolbox.
And the other benefits with it. I mean, if you're not taking it for weight loss, like you said, the microdosing.
Cardiovascular benefits, kidney benefits, liver benefits, that visceral fat around your organs, and
Exactly.
and they're saying dementia. Helps
Yes,
with
they're
dementia.
looking at
Yes.
that now. Yeah, I mean, I was actually able. Of course, my A1C had improved. I was able to get off my blood pressure medications. You know,
Wow.
uh, I'm an advocate. I know we're advocates for it from now on. I would do it again if I had to.
And one of the things you just said is they're not new medications. They've been used for years, but for diabetes, and they had other side effects, good side effects, and weight loss was one of the side effects that they had.
Yeah,
So,
yeah,
and I think
that's a big.
I think people are afraid, but when you let them know they're not new, and most of the side effects are very manageable. So,
Exactly. And diabetics, I mean, that's one of the most vulnerable disease processes in our community. So even thinking about that, it's definitely safe medication. And some of the side effects that people have talked about are minimal, are very minimal. And if you're getting that's the whole thing too, guidance and education, being with
yes.
someone that can help guide you through some of the side effects. Because
Yeah.
they're out there. I remember being on some of the Facebook sites. And some of the, and I know that they're there to support one another.
Right.
And some of the information that they have on there is right on, spot on. But you have some people, again, not in the healthcare professional, some of the suggestions they make is
Aren't
not.
right. Exactly. Exactly. So you do get a lot of people out there that are on either TikTok or Facebook, and maybe they're well meaning, and some
Exactly.
of them have excellent advice, and some of them are healthcare professionals just
Hmm.
giving advice. But there are some people out there that their advice is not very helpful.
Exactly. Exactly. Or they're talking about their experience that scares the heck out of somebody else.
Right. So, what do you say to people, since we've been talking about the GLPs, what do you say to people who say that using a GLP is cheating?
Oh my goodness. Wrong. Absolutely. Talk to someone who's on it and whose the weight is not just falling off like they thought it would.
Right.
Or hey, look at Serena Williams. That's a prominent breast examples right there.
She looks
Good
amazing.
for you. Yeah, she's amazing. This was an athlete for how many years since she was a kid?
Right. Who works out more than Serena?
More than
Yeah.
any of us probably in our lifetime. And their weight cannot come off. It's a game changer. He says it's not magic, but it's definitely a wonderful tool in our toolbox.
Okay.
I get that line from you. I mean, it's true though.
Yeah.
But it's definitely worth doing. And I would just say, and I'm not trying to disparage any doctor at all. Some doctors believe in it, some doctors don't. If this is something that you want to do, um, have a conversation with your doctor. If your doctor is just not in agreement, ask them why, or either ask her why. Try to get some idea and have the conversations, but that may be just the thing that you may need.
I find a lot of people, they'll say, well, I asked my doctor and he said no, he doesn't like that. And I'll say, well, why? Did he say why? And oh no, he said I have, my kidneys. And I'm thinking, well, it works well for kidneys.
Protection.
Number one cause of kidney failure is diabetes. This is a
Exactly.
diabetes medication. You get that A1C in check and you get that high blood pressure in check. You're preventing further kidney damage, right? So,
Exactly.
my advice to people is, if their physician or their provider says no, I don't push it, but encourage them
Actually,
to
ask more
ask questions. Yes, yeah.
questions. And I have some doctors that I work with as well, and I'm very happy with some of the doctors I've been able to work along with, because I don't try to take away from their doctor or be their PCP, because I'm here for what I do and I love what I do. But I had one example is one particular. Now, what I do ask some people to do is if they would look at sometimes getting additional labs. I'm gonna say sometimes additional labs help with even with this as well. One, I looked at her labs that she had, and she was on a thyroid medication, and I suggested that she ask her doctor if he would check her thyroid again. And from what I saw she was on, could he consider making an adjustment to her thyroid medication? From what I saw, I'm like, she needed to be adjusted. And awesome doctor, he looked at it. He did the additional testing that I have. Example is most of the standard labs may be a TSH, free T4, that may be it. Maybe a free T4, and may do a T3, but usually you want to do I'm checking a little bit, is that, TSH is fine, free T3, free T4, reverse T3. That gives you more of an idea of what your thyroid, what's going on with your thyroid. He did that. We got it back. I looked at it. I asked him, can you make this adjustment to it if he was in agreement? He was. Jump started. She was in somewhat of a stall. Jump right back. Now she's went from I think she was 180 something when she first started, and her goal is 130, and she's at about 135 right about now.
Oh, beautiful.
Happy as she could possibly be. But it was just making that adjustment that sometimes we don't know about, because the standard labs are just that, they're standard, they're not
Right,
optimal.
right.
But I'm not gonna go too much into that. But I'll
Right,
leave it at
right.
that.
So, and that's some of the important things in women's health that haven't been studied, or we don't talk about. We don't, Another thing that I found, women with PCOS.
Yes.
They have an
Yes.
amazing results with this. So,
But the good thing was being able to work along with the doctor. You know, I was happy to be able to oppose the doctor say, "Oh, I don't believe in that," or "I'm not going to do anything else." We're a group, we're a team,
yep,
we're
yep.
a team, and that's how I
Okay.
look at that. We're a team,
I
and I
like
was
that.
so happy that it was open because that made a difference in her health.
I like that. I like that.
Hmm.
So,
So,
do you have any final words for us? Any pearls of wisdom for somebody going into that next phase?
oh my goodness, I would just say, do it anyway. Do it scared. Ask for help. Just do it. You'll be so happy that you did. I'm so happy that I have. I'm in my element. I feel I'm at my calling. I love what I do. And I thank you because we're all making changes in health right now. You
Okay.
know, we're changing generations.
We are changing generations.
We're
Generational
creating
health.
generational. That's our line now. Generational health because it makes a world of difference. It makes a world of difference.
It does.
And I thank you so much for allowing me to come on here with you. We go back so far. We got so much further to go.
Well, it won't be your only time. I'll have to have you host with me.
Yes, and I appreciate it. I love it. And just women working together, it makes a difference.
Okay. Well, thank you, Deb. Thank you for joining me and our community here and sharing your story with us. Thank you, viewers and listeners, for joining us here on Dr. Angela's Ignite Your Next Phase. And keep growing, keep glowing, and step into the next phase with power. Thank
That's
you.
right. The best is yet to come.
Best is yet to come. Let's talk about it.
Yay.
to the future shining bright.
I love your theme music.
Health and